Vertebral carotid artery has 4 parts. Vertebral artery has 4 parts. The first part runs upward in the foraminal transversalia of cervical vertebra. Look to the second part. The first part runs upward in the vertebral family. Second part in the foraminal transversalia of the upper 6 cervical vertebra. Look to the third part. It comes out from the foraminal transversal of the upper, then turns backward, then medially behind the lateral mass of the upper, above the posterior arch, enter the vertebral canal, then it turns upward, enter the structure of the coronal mass. Why all this bend? Like internal carotid artery to control any sudden rise of blood pressure. These are arteries. To revise, glands of clinical importance: thyroid, parotid, submammary. Arteries of clinical importance: vertebral artery, facial, lingual, maxillary, middle minute. Veins. Actually, all the veins. كل الأسئلة كده الامتحان الكشف. Veins we have internal jugular vein, external jugular vein, pterygoid venous plexus, dural venous sinuses, especially cavernous sinus. دي الفين. بصراحة أنا شايف internal jugular vein خلص. It begins. كده it runs, it ends, tributaries. إنما pterygoid venous plexus has emissory vein connecting it to dural venous sinuses inside. والemissory veins are valves. حد عارف ليه emissory vein valves? Why? To allow flow of blood in both directions. Why? If pressure inside the skull increases, blood goes out. If the pressure decreases, blood goes down. It is a trial to keep the pressure inside the skull constant. Because any increase in pressure on the brain will damage the brain cells. Because the brain is CNS, it can't bear pressure. And the brain CNS, any injury in the CNS is irreversible. Once cells in the brain die, will never come back, except in the future, after we use the stem cells. But now we can. Can you guess another knowledge? Emissory veins are valveless veins, allowing flow of blood in both directions to equalize the pressure intracranially with extracranial. Did you want to explain how? لازم انا اجيب مسدس وخش عشان اعرف ان دي فانا يتهيألي لازم الفينز اللي في الانتر فيرتبرال فورامينا connecting internal vertebral venous plexus inside the vertebral canal with the veins outside like posterior intercostal veins, lumbar veins, sacral veins. They should be also valves. I want to keep pressure for the brain constant, but the spinal cord is the other part of the CNS. If I have to keep the pressure in the vertebral canal also, so we have veins similar to emissory veins. All the veins passing in the intervertebral foramen. And famous veins, valveless veins of Patterson, which connect the prostatic venous plexus with internal vertebral venous. انتوا عارفين الفينز دي؟ I'm talking about veins. انا كل اللي قلته glands, arteries، انا مش شايف حاجه خالص. كده ورق مقلوب. وفينز. انا في سنه ثانيه جه دكتور سالني، على فكره احنا كنا بنمتحن اولى وثانيه على بعض ايام العصر الحجري القدماء المصريين. فبيقول لي واحد a patient has cancer prostate. تعرفين ان cancer cells can penetrate veins and go to far distance to form other tumor. دي بنسميها metastasis. Vein in the abdomen may be either systemic or portal. If the cells pierce systemic vein, it will reach the heart lung, so it will form second tumor in the lung. If it pierces portal vein, it will go to the liver, forming second tumor in the liver. He asked from the lung, it can reach the brain, but it has to reach the lung first. From the liver, it can reach the lung, then the brain. This means that cells or metastases or far tumor will not appear in the brain unless they start first in lung and liver. He asked me, a patient has cancer prostate and he developed tumor in the brain, and we discovered that liver and lung are free. Because of the valveless veins of Patterson connecting the prostate with the internal vertebral venous plexus, and the veins inside the vertebral canal are also valveless, so cancer cells can go from the pelvis to the brain directly, bypassing brain and lung. You understand? bypassing liver and lung. عشان كده يا اخوانا انتوا بتحفظوا. You memorize the knowledge, but you don't try to know what's behind this knowledge. فانا لو عندي veins انا راح اجيب pleural venous sinuses, cavernous sinus او cerevoid venous. بس ده ما يمنعش ان انا اجيب الباقي. خدوا بالكم انا بقول انا راح اجيب بس مش راح اجيب. انا قلت راح اجيب pleural venous sinus فيها cavernous sinus، بس ما قلتش مش راح اجيب internal tracheal vein. ما قلتش مش راح اجيب external tracheal vein. انما انا بقول لو خيرت يبقى اجيب pleural venous sinuses و cavernous sinus. خصوصا لو عرفتوا ان cavernous sinus خطير. has structures inside common carotid artery and abducent nerve. Has nerves embedded in the lateral wall and floor. Oculomotor, trochlear, ophthalmic, maxillary. Has structures outside, medially related to pituitary gland, sphenoidal ear sites, laterally related to uncus of hippocampus of the temporal lobe, related to trigeminal ganglion. Infection spreads from outside to inside. Infection outside the scalp is very easy, open and drain. Inama infection inside the scalp. If infection reaches cavernous sinus, it may lead to death. Yes, if it blocks internal carotid artery, death or paralysis. It may lead to squint, howl, due to paralysis of abducent, oculomotor, trochlear, right? It may lead to pituitary disturbances if infection reaches pituitary gland. It may affect smelling if it spreads to uncus of hippocampus of the temporal lobe, which is responsible for smelling. Right? Strange enough, it may lead to Horner syndrome. Although I didn't mention any sympathetic inside the cavernous sinus. And out inside the cavernous sinus, internal carotid artery, abducent in the lateral wall, blah, 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 outside, blah, blah, blah. And I didn't mention it. Yes? What? Internal carotid is surrounded by internal carotid sympathetic plexus, which is branched from superior cervical sympathetic ganglion and is considered as a continuation of the sympathetic chain inside the skull. سنسمين في 10 درجات بتعالي في 10 I promise سنسمين هتاخد 10 درجات في الشفوة من دلوقتي. الله يسهل له. خلاص؟ فكرت each artery is surrounded by a plexus. عشان كده على فكرة طبعا لو كنت يا رب امشي؟ لا. انا ورايا عيال اربيها ولا هفضل على طول. ماشي انت بتصور يا ابني اقطع الحته دي. خلاص؟ اولا انتوا لغايه دلوقتي استفدتوا حاجات كتير قوي. استفدتوا ثايرويد، باروتيد، سبمانديبولار، فيرتبرال، فيشيال، لينجوال، سوبير ثايرويد، انترنال قصدي ميدل مننجيال صح؟ واستفدنا تريجويد فينس بلكسس كافيرنس ساينس كده. اللي اقول ايه الحكمه؟ What's the wisdom of putting internal carotid artery inside the cavernous? Inside pulsation. Venous return is by the tone of muscle, but inside the skull there is no muscle. What helps the venous return from pleural venous sinus? The pulsation of internal carotid. Also it is dangerous. If any horror occurs in the internal carotid artery, أي foramen, sorry, يحصل في الانترنال carotid artery, this will lead to arteriovenous system, and the blood will rush from high pressure to low pressure. You find the patient with eye congeal, the pressure في cavernous sinus increase because the blood from internal carotid to cavernous sinus making congestion of our. Now, كده خلصنا. الاخوان عارفين انا ما وصلتش الحركات دي. انا بعلم عشان ما انساش انا قلت ايه. الديورال فينس ساينس. انت سمعت يا دكتور انا قلت ايه؟ لولا ان الفتنس بتاعتي مش كويسه كنت جريت ورايا. يا اخوانا you have 2 minutes. اي واحد عايز يخرج يتفضل. اللي عايز يخرج. Anyone wants to go, he can go now within 2 minutes. اللي هيخرج بعد كده هطلع له المشط. ولو اتكيتوا عليا الديورال فينس ساينس سوري الديورال فولز. انا بالنسبه لي الديورال فولز طز فيش. مش هيجي لي عيل يقول لي I will never expect a patient coming and say my fox is dry. shivering with pain. My territorial cerebri rushed down to the bottom of the room. أنا عن نفسي but if somebody asked me to put a question about the pulse of the dura mater, I would put اللي بيفهم انجليزي territorial cerebri. Because of the dural venous sinus is related to territorial cerebri. حد بيعد ورايا؟ Nerves. على فكرة nerves represent the biggest compartment of the hidden nerve. Of course we have the cranial nerve, trigeminal nerve, fifth cranial nerve, facial nerve, lower fourth cranial nerve, glossopharyngeal, vagus, accessory, hypoglossal. Do you know why the nerve accessory is called the accessory? Accessory means helping. Vagus found itself distributed to many areas. The vagus ده نفسه تايه. We supply the neck. Vagus supply the neck by the thorax. Supply the abdomen. It reaches till the mid-gut. It reaches the testis. Both testes develop in the angle between the vertebral column and the last rib. زاوية بين الصلب والصلاه. But it migrates out. It's growth. It takes nerve supply from vagus. The vagus protested. It's too much for me. I need help. So God created accessory nerve to help the vagus. Even the cranial accessory joins the vagus to help the vagus. You understand? على فكرة, by the way, did you see a football match? Did you see when one of the soccer players received big, strong hit to his testis? What the other player do to him, or the medical team? They try to make him make activity. Because trauma to the testis, being supplied by the vagus, it will lead to excitation of the vagus. With the reflex, increased vagal tone. This increased vagal tone will depress the SA node in the right atrium. You know that parasympathetic supply the atria but not the ventricle. And it may slow down the heart. And if this player is unlucky, heart may stop. Okay? Although there is a phenomenon, vagal escape phenomenon, but if there is problem, he may die. To avoid the increased parasympathetic vagal tone to the heart, stimulate the sympathetic. And sympathetic is the nerve of fight, nerve of fear, nerve of activity. So let him make activity and increase the sympathetic tone to antagonize the increased vagal tone on the heart. Okay? So nerves. I started making the audio. What are the types of nerve fibers in the human body? واحد يرفع رجل ايده ويقول يا اخوانا انا كل ما ابص واول ما واحد يرفع ايده يبقى الكل عايز يجاوب. الكل عايز يجاوب بس شكلكم كده عايزين تجاوبوا دون مسؤوليه. كام نوع؟ اتفضل. 7. يا نهار اسود. 7. جبتهم منين دول يا اخي؟ لا I mean human being, not monster, not elephant. لا انت كنت بتتكلم على الفئه بتاعتك الديناصورات ولا كده؟ انا بتكلم على human being. انت بتصور يا ابني؟ الحقيقه هم 7 فعلا. 7 طيب. انا شفت ناس حواجبهم طلعت لغايه لما لمست السكاب شاركت في السكاب. اقسمهم ازاي؟ انا ممكن اقسمهم موتور سيل او اقسمهم سوماتيك وفيسل. معايا؟ لما اقول سوماتيك في موتور سوماتيك نوع واحد which is the nerve supply of all the skeletal blood fluid. معايا؟ يبقى general somatic motor. This is general for all somatic motor. There is no special somatic motor. But sensation, there are 2 types coming from the body wall. Body wall means ectoderm. Body wall means ectoderm, skin covering the body wall. General sensation, pain, touch, temperature, pressure. Okay? This comes from anywhere. So general somatic sensation. But retina and organ of course are both ectodermal organs. They belong to the body wall so much. But they are sensitive only for vision and hearing. And this is not general. Can you see by the tip of your finger? Can you put the tip finger in the hole of the key to see what's doing inside, what's going inside? Yeah, but these are special somatic sensations. So somatic fibers are 3. 1 motor and 2 visceral fibers. Visceral fibers. 4 types. 2 motor and 2 sensory. The 2 motor, general visceral motor, to all smooth muscles and glands. And this includes sympathetic and parasympathetic. Imagine sympathetic and parasympathetic are included in 1 type. 1 type, which is general visceral motor. You understand? But muscles of the pharyngeal apparatus, they are visceral, coming from the pharynx, but they are striated blood. These are special visceral muscles. So nerve supply is special visceral motor. You remember? 5, leave 6, 7, leave 8, 9, leave 10, 11. 5th cranial nerve is the nerve supply to the first pharyngeal arch. Forget about the 6th. 7th cranial nerve is the motor supply, is the nerve supply to the second pharyngeal arch. Forget about 8. 9th is the nerve supply of third pharyngeal arch. 11th is through the vagus. And then supplies 4th and 6th pharyngeal arches, while the 5th degenerates and disappears, leaving no muscle. This is special visceral. So we have general visceral motor from special visceral motor nerve supply to the pharyngeal arch. But sensations, general visceral sensation, come from all viscera. Can you tell me what are the sensation coming from the viscera? A sensation, either colic or distension. Colic, magma, or distension. You know, both are due to ischemia. When the muscle goes into spasm, all the blood vessels among the muscle will be closed. When the organ is distended, all the arteries in the wall will be closed. So I can say visceral pain is ischemic pain. It comes from anywhere in the viscera. But nose and tongue both develop from the pharyngeal apparatus. You remember? So it's visceral in origin. So these are spatial visceral sensations. These are the 7 types. Thank you. Okay? So we have nerve, trigeminal, facial, lower cranial nerve, cervical sympathetic plexus, parasympathetic ganglion, spinopalatine, optic submandibular sacrum. وفي ناس كده اي كلام انسى سيرفيكال سيرفايكال plexus، انسى سيرفيكال ما كانوا فيهم ضغط طول معايا ادي الناس. بس بيني وبينكم في برانش من الفيشيال نيرف يستاهل اجيبه في الامتحان. برانش من الفيشيال نيرف deserves to come in the exam called chorda tympani. Chorda tympani. One of the 2 terminal branches of the nervous system. انتوا بتنسوني انا هجيب ايه في الامتحان بتاع السنه اللي جايه. على فكره لا حد يقدر يقول لي ايه اهم صفه؟ What's the most important؟ انا بقول اي حاجه بس انتوا بتاخدوا اللي بين السطور اللي خدتوه اللي انتوا كتبتوه مش كده؟ ثايرويد، باروتيد، سبمنديبيولار، مش كده ده اللي كتبتوه؟ انما اي كلام تاني من باب الايه؟ ان انا افهمكم من كل اللي كتبتوه غلط. واحد يقول لي what is the most important feature of the first order neuron in the pathway of any sensation?
Outside the sinus. Outside the sinus.
Outside
the sinus.
Outside the sinus. Yes. Are there any neurons outside the sinus? Yes. Present in? Ganglion. يبقى first order neuron also present in ganglion. But second order neuron. Don't tell me inside the CNS because the third also inside the CNS. What's the other? Second order neuron almost cross to the opposite side. Inside the CNS and cross. What's the main feature of the third order neuron? In the thalamus. Right? These are the features. حد منكم ذاكر pathway of taste؟ Taste. Pathway of taste. Can anyone tell me where does the first order neuron lie? عايز حد يرفع ايده ويجاوب. اتفضل. ايه؟ قول لك first order neuron. قول لك first order neuron always outside. بلاش always. Mostly outside. حد يقول لي first order neuron in the pathway of taste. This is the bottom. This is the receptor. انا كده هقع مش هعمل حاجه ولو انا وقعت في الموت واحده هتقول اللي انا قلته. ايه انت مصور؟ ايوه. كورتا تمبرال مع ان الفيرست اوردر نيورون قلنا جه. عرفتوا وجهها منين كورتا تمبرال؟ كورتا تمبرال زي ايه؟ جانجليون ولا نيرف؟ نيرف. تقوم تقول لي anterior 2/3. Yes. جانجليون very good. انت قلت كده؟ والله بس قلت في سر. يبقى نطرش.
يا ألف سلام.
مع حاجه من الاثنين، يا ألف سرها يا انا قريب فريق نطرش.
ألف سلام.
قلت ايه يا بابا؟ ايه؟ مين؟ انا رجعت الكلام. جينيكوليت جانجليون. اجابه ناقصه. ايوه لسه ايه؟ glossopharyngeal nerve. انتوا معايا؟ glossopharyngeal nerve carries superior and inferior sensory ganglia in the jugular foramens. These contain nerve cells. Represent يبقى cells of the geniculate ganglion represent the first order neuron in the pathway of taste from the anterior 2/3 of the tongue. Ganglia of the glossopharyngeal represent first order neuron in the pathway of the taste sensation from the posterior 1/3. في تاني؟ Yes. Inferior ganglion of the vagus contains first order neuron in the pathway of taste from the root of the tongue, vallecula of the tongue, epiglottis. Okay? مين يقول لي بقى؟ First order neuron in the pathway of taste from the palate. Can you feel taste from the palate? Yes, there are taste buds in the palate. Where's Billy Salt? First order neuron in the pathway of taste from palate. Geniculate ganglion. Because geniculate ganglion is ganglion nervous intermediate, which gives chorda tympani to the anterior 2/3 of the tongue and greater superficial petrosa supply دي ناس. بس بيني وبينكم انا بموت في كل اللي قلته، بس بحب قوي الباراسمباثيك جانجليا وبحب الكوردا تمباناي، بس ما بكرهش الباقي. Spaces in the head and neck. We have anterior triangle, posterior triangle, suboccipital triangle, temporal and temporal fossa, and pterygopalatine. راحة مش في أغنية بتقول راحة على فكرة أنا كنت بمتحن بكالوريوس سنة 5 كان بالنسبة لي، ما كانش فيه سنة 6 لسه، كان العلم اتنيل فكان بيقضيه 5 سنين بس معايا، يعني كان كتاب التشريح قد كده، أما الاستوديو ما كانش له كده. الجراحة كان 5 ورقات بيوزعها علينا رئيس الناس، فكان يا دوبك كفاية علينا 5 سنين. السبيس التجاري posterior triangle of the neck and differential diagnosis of swelling in the triangle. على فكرة لما يجي لي triangle anterior triangle او posterior triangle بقول side shape، وأجي لي triangle shape triangle معمول ايه؟ triangle ولا inverted triangle معمول. boundaries، واحد جاله boundaries of the anterior triangle كتب من قدام anteriorly middle line of the neck, posteriorly anterior border of sternum muscular, base above base of mandible, angle of mandible, imaginary line from angle of the mandible to muscular power. وخرج يقول لك الدكتور اللي هيصلح الاجابه بتاعتي هيتحرق، يصلح اجابتي يتحول الى دماغ رومان، because the answer is so perfect it's going to die، and يلاقي نفسه واخد 2 out of 5، 1.5 out of 5، لأن قلنا boundaries include roof and floor. Boundaries are not borders. Boundaries of anterior triangle and floor. Okay? حد يعرف what is the floor of the posterior triangle of the neck? Floor of posterior triangle of the neck in one word. الدكتور اللي لابس بامبا متخطر. ايوه اللي لابس تحتيها فلنة سود. تفتح القميص عشان نشوف الباقي ولا ايه؟ وانت قاعد. Floor of posterior triangle of the neck in one word. كلمة واحدة. ايه؟ انت لابسه قميص بامبا مخطط وتحتيه فانلة سوداء. يا استاذ يا استاذ 3 muscles. لا في سجاده على 3 بلاطات دول. The direct floor is not formed by the 3 muscles. دي فاشيه وده فاشيه لا Skeletal form fascia. ايه الفاشيا اللي فاشيا منك؟ You have 7 layers of the fascia of the neck. هي عارف دي فاشيا اللي هو عليه 3 عادي ده دكتور وعارف. Prevertebral fascia. Because the 3 muscles you mentioned are prevertebral muscles. The real floor of the posterior triangle is prevertebral fascia. بس طالب يقول لك انا جات لي في الامتحان قلت له سكالينس الميديا ليفيتو سكابولي سبلينيا سكابيتس. لا the real floor of the posterior triangle is prevertebral fascia. ده floor الاصلي. Patient had inflammation of the cervical vertebrae. There is a special disease which affects bone, destroying bone, converting bone into pus. TB. And the man discovered TB of the bone. People before thought that TB is only disease specific for the lung, but we discovered that it is a general disease. It can affect any part of the body. There's TB of the brain, TB of the meninges, TB of the bone, TB of the prostate, everywhere. But primary TB affects the lung. Secondary TB affects anyone. And man came with abscess in the axilla. And the doctor examined the axilla. He discovered that everything in the axilla is okay. Nothing wrong about the axilla. He checked his vertebrae. He found one cervical vertebra is missing, completely destroyed, and converted into pus. حولت لصديق. What's the relation between cervical vertebrae, TB, affecting cervical vertebrae, and the axilla? Nerve supply. هي nerve supply by S ولا Z؟ ممكن تبقى nerve supply. ها؟ على فكرة أنا بحث إيه؟ نف إيه؟ lymph drainage. يا سبحان الله. Can that you have to be a bit intelligent and use the word I mentioned before, prevertebral fascia. I was explaining prevertebral fascia. Then suddenly I jumped to pulse disease. Did you hear about femoral sheath? This is in upper limb or the lower limb? It is an extension from the abdominal pelvic bag of fascia. Bag of fascia in the abdomen, fascia iliaca and fascia transversalis, down to the femoral triangle. And it's very important because hernia, femoral hernia may descend in faith. Imagine brachial plexus and subclavian artery pass between scalenus anterior and scalenus medial, going from the neck to the upper limb through the apex of the axilla. But why the brachial plexus and the artery are projecting? They face the fascia. They have to pierce the fascia. But the fascia is soft. They push the fascia in front. معلش انا هضحك القميص الثاني. They push the fascia like a sheath. And brachial plexus and subclavian artery went down into the axilla, pulling a conical sheath. Conical sheath. When you push any tissue, it goes like a colon, like the femoral sheath. pushing the conical extension from prevertebral fascia in the floor of the triangle into the axilla, which is called axilla, similar to the femur. Imagine if you have a cone or pus. If there is pus in the neck, pus is fluid. It will trickle under the effect of gravity, and it will collect to the axilla. يعني if a patient went to a doctor and he checked her found abscess in the axilla. You understand? So the doctor aspirated the pus and gave treatment. After 1 month, the abscess came back. When the doctor changed the treatment and aspirated the pus again, the abscess came back. She decided to change the doctor. She went to a recently graduated doctor, but intelligent one. واحد لسه في الامتياز. قلت له I have pus abscess in the axilla. قال لها show me your in the back of the neck. And he checked the back of the neck, he found center. هي قالت بقى ده نصاب. This is cheating me. This is this doctor does not know anything. I am complaining from the axilla. And he is حاسس على أفاسه. Touching the back of the neck. And then Allah, you have pulse disease, you have to give TB treatment. It was so successful because he remembers the axilla. These are the spaces, and as regards the spaces, يا اخوانا انا كل مره حتى الولد What is the marvelous space you have in the internet? أنا كل مرة كنت بروح اسكندرية كنت بروح تاني في الستات. قصدي why this is an area. اشتري منها كل اللي أنت عايزه. What is the marvelous space كتصور؟ Terrible Palestine. I like terrible Palestine. But I don't hate temporal and intratemporal. I don't hate anterior triangle and posterior triangle. Lymph drainage of the head and neck. This is very important. You know why? Because cancer spreads along lymphatic. You know, I dislike muscles. I don't like muscles. But I don't hate. I don't like. ما أحبش بس ما أكرهش. I am neutral as regards muscles. In the head and neck you have a lot of muscles. Muscles of mastication, sternomastoid, infrahyoid, digastric, muscles of the tongue, orbicularis, oculi and vaccinator, frontocephalic, scalenus anterior, thyroid apparatus. All these are muscles in the head and neck. The key muscle of the neck is the sternomastoid and digastric. Actually, ما بحبش البيتزا. ما اقدرش اتقطع. واحد طلعت البيتزا وانا قاعد مستمتع. واحنا بنتفرج على ما جاش بدري ما شافش الميكي ماوس. الأنكوليا الأنكوليا. بس المشكلة إنه the whole most of the blood will go to the intestine. With vasoconstriction of the arteries going to the brain. After you eat the fill your stomach, until you get your blood back to the brain, it will take 2 hours. To teach my father, I accustomed to eat every 2 hours. So that is a boy. كنت باكل كل ساعتين، اقعد متنح ساعتين على ما فوق اكل، اتنح ساعتين على ما فوق اكل. ما تقدرش تقول لي ذاكر. You can't tell me study. Every time he asked me to study, I felt my blood supply in my I prefer the key stones of the muscles, sternomastoid and digastric. Although muscles with mastication are very important too. Can anyone tell me what is the function of orbicularis oculi in one word? Eh? This is the one. The one? What's the one? تصور يا ابني؟ قال بروتكشن. طب قولي لي العصا اهي. داخل على بعض. orbital part. How can it protect? Close the eyes. Strong closure of the eye to protect the eye from wind or light, strong light. What about the palpebral part? Gentle closure of the eye. Does gentle closure of the eye protect the eye? انت بتقفل عينك جنتل. انت المذيعات بتاعت التلفزيون اللي هم طول معاهم. Gentle closure of the eye, mostly during sleep. Does it protect the eye from evaporation of tears? Because the cornea is avascular, and this may lead to ulceration of the cornea. You know the people having facial paralysis? They sleep with eye open. They have to put ointment, marham, to prevent evaporation of tears, which is the source of nutrition and oxygen supply to the cornea. طب lacrimal part, how does it protect? على فكرة lacrimal part acts on both attachments. It pulls on the wall of the lacrimal sac, widening it. When you widen the lacrimal sac, you create negative pressure inside, which sucks the tears through the punctum and lacrimal canal equilibrium. At the same time, it pulls the lateral angle of the eye medial. بصوا كده انا هقفل عينيا. Look to my eye. See my finger? It goes medial. Why? Because the drainage of the teeth is only on the medial angle. At the punctum. You understand? What about the teeth at the lateral angle? When the lateral part contracts, it widens. It pulls the lateral angle medially, widening the teeth from lateral to medial. It's draining the teeth. Protection to the eye. Do you know some people will have disease, blockage of the pancreas, blocking of the lacrimal canal equilibrium, and when you see all, you see them lacrimating. They will have exentus dermatitis behind it. It happens behind it. يبقى drainage is awful. واضح من المسلز ان انا بحب كل العضلات بتاعت ايد النجم، بس الحب الاول كان ستيرنوماستويد ودايجاستريك ومسلز الماستيشن واوربيكولار ستيلاي ومسلز اوف ذا تانج. مسلز اوف ذا تانج. على فكره فاشيا اوف ذا نيك از فيري امبورتنت، خصوصا الدكتوره اللي قالت فاشيا هنا، فاشيا. انما في جنرال انفستنج، في بري فيرتبرال، في بري تراكيا، فاشيا. على فكره you have the isthmus of thyroid gland crossing in front of second, third, and fourth trachea. If you have to make elective tracheostomy, لو عايز تفتح trachea elective يعني by your choice, you choose the time, not emergency. If there's emergency to open the trachea, open it anywhere. But if you have to choose, I'll make the operation tomorrow, I'll make the operation after tomorrow, then it's not emergency. Should I make it above the isthmus or below the isthmus? Above the isthmus. Above the isthmus, there is only one trachea ring. And if you make tracheostomy above the isthmus, for sure, you are going to injure the larynx. Recoil cartilage. Do you understand? Should you make tracheostomy and then the patient has trouble, will face trouble talking later on, or breathing? No, I don't want to injure the larynx. So above the isthmus is not the site of the joint. Below the isthmus, there's 5, 6, 7, 8, 9, 10 trachea rings. Ample space. But also I will not make it below the isthmus. You know why? على فكرة أنا كنت بختبر ذكاء. I was testing your experiment. And I was talking about pretracheal fascia. And nobody thought about pretracheal fascia. Look, when you make tracheostomy, you have to put a tube to keep the opening of the open, keep the hole open. But look, if you go below the isthmus, the trachea recedes back. Trachea goes back till it enters the thorax behind the heart. Trachea behind the heart. Here the trachea is in front. But when you follow the trachea down, it goes backward. This means it gets away from pretracheal fascia. This means that below the isthmus there is a distance between pretracheal fascia and trachea. If I put you, it will not be fixed. Any movement in the fascia may pull the tube out of the trachea. This means that tracheostomy tube will not be stable, will not be fixed. Because the trachea recedes back away from pretracheal fascia. So the pretracheal tube would be away from the tracheal fascia, would be away. And the pretracheal tube may slip out. And this may lead to entry of gas bubbles inside pretracheal fascia. And go down till the arch of the roof. You remember when there are gas bubbles in the tissue? You remember when the lung, all the alveoli break up and the lung become converted into large spaces? Emphysema. Emphysema of the lung. When oxygen, air bubbles go to the tissues, it is called emphysema because of surgical emphysema. And goes to what? To the superior mediastinum. Did you hear about narrow areas in the human body? سمعتوا عن الأجزاء الضيقة في جسم الإنسان؟ Give me an example. You got about narrow parts in the human body. Carpal tunnel. Carpal tunnel ده قليل. بس انتوا كلكم قاعدين بتقولوا انت ليه بتفكرنا بالماضي؟ ما اتكلمنا عن المستقبل. الماضي فات مات. Carpal tunnel is so narrow but very crowded. There's one nerve. Two synovial teeth. 3 tendons of 3 muscles. Plexus, scapula, 9 tendons of 3 muscles. But once pressure increases inside the carpal tunnel, one will get suffocated. حتى يتخنق. Which is the nerve. What? Median artery. Because I mentioned before that pressure affects structure having, and median artery is one of the branches, the first branch from anterior thorax. Forget about this. What if air goes into the superior mediastinum? You consider superior mediastinum narrow area? 2 inches by 2 inches by 2 inches and contain more than 30 structures. If pressure increases in the superior mediastinum, exactly like pressure increasing in the thoracic inlet. Exactly like pressure increasing at the root of the neck. Compress the trachea, listening. Compress the esophagus, fainting. Compress common carotid artery, decreasing the blood supply to the brain, fainting. Compress the laryngeal, process of pretracheal fascia is very important in case of tracheostomy, and the site of choice through the isthmus. طب الاسمس نعم انت قلت كده والله
انا ما قلتش.
مين اللي قال يرفع عليك ايده؟ سبيك اب انت قلت كده كل اللي هو له درجات يمين 5 درجات. طب والله بديها لهم والله انا فايض معايا كام درجه من السنه اللي فاتت. طيب joints of the head and neck.
كم درجة؟
temporomandibular joint. خلاص انا كده ضيعت وقت ده. temporomandibular joint, ligaments of atlantoaxial and atlanto-occipital. Specialities of the head and neck. We have orbit, pharynx, ear, soft palate. Larynx, nose, mouth, tongue. All these are specialities of the head and neck. I prefer to postpone specialities to specialities. I prefer to study anatomy of the orbit in details with ophthalmology. An ear with ENT. And larynx with ENT. Okay? لكن بص معايا اقول صوت orbit extra ocular muscle لا ما تكتبوش. motor orbital nerve ophthalmic division of trigeminal and ciliary gland lacrimal gland. I think that I will care much about sensation in the oral. Pharynx, muscles of pharynx, constrictors and gaps between the muscles. Constrictor muscles and gaps in between. Ear, facial canal in the middle ear. Soft palate, nerve supply, soft and hard palate. Larynx, nerve supply. Nose, lateral wall of the nose. Mouth, mucous membrane of the tongue, lymphatic drainage of the tongue, blood supply of the tongue, nerve supply of the tongue. واضح ان اكثر سبيشاليتي انا خصصتها بالاهتمام هي البق ماوث. كده اي حاجه بره اللي انا قلته يجي في الام سي كيو ويجي في الشفوي. B. الله أعلم. نيورو ورقة. برين ستيم. External feature attached to the cranial nerve, blood supply. Base of the brain, interpeduncular fossa. I don't like to ask about sulci and gyri and so on, but I am concerned with important functional areas of the brain. Types of fibers in the white matter of the cerebral hemisphere. Association, commissural, projection. By the way, commissural are very famous, and the most famous commissure of the brain is corpus callosum. Do you need, what is the function of association fiber? Do you need to connect the function of the frontal lobe with the parietal lobe, with the temporal lobe, with the occipital lobe? Do you need cooperation between these lobes? I'll tell you an example. I'll show you a coin, 1 pound. I'll show you, you are receiving the image by your eye. You are seeing the big coin. The edges are serrated. There is one rhythm, one guinea. Okay? And spade. You receive the image of the coin by your eye. In which lobe? Occipital. Then I'll ask you to shut up your eyes. And I'll give you 1 piastre in your hand. I change the coin. Instead of 1 pound, I gave you 1 pound of the old pounds. Now 1 pound of your time is equal to 1 piastre in my time. Since long time. I'll give you the piastre in your hand, that's all. And then your eyes closed. I'll tell you, is this the coin you had seen by your own eye? هتبتدي تحسس. You're using tactile sensation, but tactile sensation is received in the parietal lobe, right? You're going to tell me this is not the coin I had seen. But you received the image in the occipital lobe. How can you say that this is not the coin by the parietal lobe? There must be association. Okay? Then I'll ask you to close your eye and I'll get a coin 5 pounds. And I'll tell you, I have now a coin. Not 2 centimeters, not 3 centimeters in diameter, it's 5 centimeters in diameter. And written which is 5. Is this a coin you have seen? I will look like the coin I have seen is only 3 centimeters and there is 1 on it. But this has a circle on it. I'm telling you, the image by auditory sensation in the temporal lobe. This means that you need to connect parietal with occipital with temporal or ordinary parts. So I would like to have good knowledge about white matter of the cerebral hemisphere, types of nerve fibers in the cerebral hemisphere. Brain stem, base of the brain, important functional areas, nerve fibers, ventricles, lateral, third, and fourth ventricle. I don't know why I have special affinity to the fourth ventricle, but you had it in the mid-year exam. So I would like to see inside the ventricles. CSF, production, circulation, drainage, function, amount. Internal capsule. Blood supply of the brain is the most important subject in neuroanatomy. Most of the diseases and the accidents in the brain are vascular accidents, whether hemorrhage or thrombosis or embolism. In neuroanatomy, I mentioned brain stem, external features, attachment of cranial nerve, blood supply, interpeduncular fossa, important functional areas, all nerve fibers of the cerebral hemisphere, especially commensurate, CSF and its circulation. Choroid plexus of the ventricle. Basal ganglia, internal capsule, blood supply. Again, neuroanatomy. أصل لها اشتراك في الماكو. عامل لي عضلات يا عم. انت لو شفتني وانا صغير الخط طلعت سبيشن بتاعتك كده طبيعي لما كنت صغير يعني وانا في الامتياز او في اولى طفل 15 سنه كده كان العضلات بسم الله ما شاء الله. Before I realized that I have to study to have hope in Asalain, so I stopped all exercise for the sake of having job in Asalain. I accustomed to training, and while training I accustomed to drinking. One day I was training, and I had the cup in my hand, and I was so busy to go to the other room to put the cup on the table after finishing drinking. I don't want to waste my time. I want to finish my training. So, where can I put the cup? I put it on the floor. ده ما تحطش عليها جزم. انا كل كلامي انا بتصور. على فكره abdomen is a برميل has anterior abdominal wall and posterior abdominal wall. انا ما شفتش حد معترض ويقول لي there are lateral walls too. انا اديتك 10 قبل كده، عايزه كام؟ طبعا انا بقول لك انت داخله على طمع. انا ببص لك انت مش انت اللي لابسه طالعه في القران. خش ده ممكن اعرف على فكرة بالنسبة لانتيريور ابدومينال وول انا ما بحبش اقول لك قول لي external abdominal origin direction insertion. So it arises by a fleshy digitation from the outer surfaces of the lower eight ribs interfacing with the rectus anterior. But I would like to ask you about inguinal ligament. I would like to ask you about vertebral triangle. I would like to ask you about conjoint tendon. I would like to ask you about inguinal ligament, lumbar triangle, conjoint tendon, premusteric muscle, rectus sheath and muscle, linea alba and linea semilunaris, arterial and venous supply of the abdominal wall, anterior abdominal wall. I would like to ask you about the inguinal canal and shutter mechanism of the inguinal canal. I would like to ask you about spermatic cord, covering, contents, wall scrotum, and anatomy of the test. لكن I'm interested much. على فكرة كل اللي انا قلته ده clinical application. inguinal canal. Again, inguinal ligament, inguinal canal, conjoint tendon, lumbar triangle, premusteric muscle, rectus sheath and muscle, linea alba, linea semilunaris, spermatic cord, testis, scrotum, arterial and venous supply of anterior abdominal wall, nerve supply. قولوا لي انتوا عارفين ان البيبي ما كانش عنده inguinal canal. Early in the fetal life there was no inguinal canal, but inguinal canal is created by descent of inguinal canal is created by descent of testes, right? Oh, because some boys have undescended testes, but still they have inguinal canal. And what is more exciting, the females have no testes, but still they have inguinal canal. Okay? Inguinal canal is created by descent of gubernaculum ovarii or gubernaculum testis. Gubernaculum, the ligaments coming down from the ovary and the testis, and descent of processus vagina. Boy having undescended testis still has inguinal canal and has processus vagina. Again, anterior abdominal wall. Anastomosis in the anterior abdominal wall. Would you like, if you have the chance, to study arterial anastomosis or venous anastomosis? Venous. Venous anastomosis. Do you know that there are portal veins inside the umbilical? Para-umbilical veins. And there are systemic veins radiating from the umbilicus of the anterior abdominal wall. There is portosystemic anastomosis between para-umbilical veins inside, which are portal, and systemic veins of the anterior abdominal wall. By the way, systemic veins of the anterior abdominal wall above the umbilicus go to axillary vein. Below the umbilicus, they go to femoral vein. Do you understand? This means that above the umbilicus is the territory of superior vena cava. Below the umbilicus is the territory of inferior vena cava. You understand? In cases of portal hypertension, this anastomosis will open up. If you look at the umbilicus in the mirror, can you see veins radiating from the umbilicus? No. This means that the veins radiating from the umbilicus are not normally seen. But in case of portal hypertension, with widening of these anastomosis, they appear as the head of Medusa, caput Medusa. Okay? You know the old stories about Medusa with the snakes coming out from the head. By the way, if you see a patient with all signs and symptoms of portal hypertension, he has esophageal varices, he has pilus, but he doesn't have caput Medusa. Does it deny the diagnosis of portal hypertension? If you have a patient having all signs and symptoms of portal hypertension, he has esophageal varices and hematemesis, vomiting blood. He has pilus and bleeding per rectum, but he doesn't show caput Medusa. Will you say there is no portal hypertension? Do you expect a patient with portal hypertension without showing caput Medusa? Yes. You know why? Because the para-umbilical veins inside the abdomen are occasional. May be present, may be absent. The para-umbilical veins inside the abdomen, which are portal, are occasional, present in some people and absent in the others. This means, if you see caput Medusa, you can swear, Wallah al-Azim has portal hypertension. But if you don't see caput Medusa and you have all other symptoms, you can say, Wallah al-Azim doesn't have portal hypertension. I think for البطنة والجراحة in medicine and surgery, we say caput Medusa is a good positive sign. Positive sign. Its presence makes you positive of the diagnosis, portal hypertension, but it's not a good negative sign. Its absence does not deny, it's not against diagnosis. You understand? This is the first anastomosis in the anterior abdominal wall. The second anastomosis, lateral thoracic vein, drains into axilla. Superficial epigastric vein, drains into great saphenous, femoral. There are two or three vertical venous channels connecting superficial epigastric vein down with lateral thoracic vein above. These are communication between superior vena cava and inferior vena cava. We call it vena cava anastomosis. Do you know, some patients may suffer from superior vena cava obstruction or inferior vena cava obstruction due to thrombosis or due to constrictive pericarditis. Inflammation of the pericardium constricting superior vena cava. You know what will happen? You will see 2 or 3 venous channels dilated and tortuous in the anterior. Can you see these vertical channels in normal person? They are called thoracoepigastric. Can you tell me Is it superior vena cava or inferior vena cava obstruction? Yes. By milking test. Milking. You get two fingers on the vein. Move up and down. This segment will be empty. Try first removing the finger below and see the velocity of filling. Try again and move the finger above and see the velocity of filling. If filling from above is faster than below, it is superior vena cava part. If filling from below is faster, it is inferior vena cava part. There is similar inferior. There is a question saying, discuss vena cava anatomy. You have a lot inside the rectal sheet. Superior epigastric vein, inferior epigastric vein. Azygous vein, inferior hemiazygous. But all these veins have no clinical significance because when they are dilated, you cannot see by the naked eye. I can't see superior and inferior epigastric veins inside the rectal sheet because they are deep to rectus abdominis. I can see dilated azygous and hemiazygous. They are inside, but I can see thoracoepicture. So if I ask you to mention only one vena cava anatomy, I will mention thoracoepicture because it has clinical significance. But if I tell you enumerate, you have to mention all vena cava anatomy. Okay? Posterior abdominal wall. You have aorta, inferior vena cava, psoas major, quadratus lumborum, lumbar fascia. A patient came with an abscess in the femoral triangle. Abscess in the femoral triangle. I checked the roof. Roof was okay. I checked the floor. Floor was okay. What? Psoas fascia. The sheath around psoas major, which is called psoas fascia, it is funnel shaped. And you know that psoas major arises from the bodies of lumbar vertebrae. You remember spots in this? TV of the vertebrae. If it affects the lumbar vertebrae, pus will break it down inside. That's why in the first year, if I ask one of the students, what are the most important structures in the femoral triangle? From the anatomical point of view, you'll find the same thing. Femoral artery, femoral vein, femoral nerve, inguinal lymph node. I will answer and say femoral sheath, psoas. Because they represent the common clinical significance, femoral hernia, and psoas. Psoas absent. So I would like psoas major. Diaphragm, origin, insertion, nerve supply, major and minor opening. Strange enough, a muscle to act, it has to cross a joint. عشان عضلة تشتغل لازم تعدي الجوينت. Can you tell me the word joint is derived from which English word? Joint. The word joint is derived from the word join. Because joint is the site where two bones join each other. You expect some joints which allow no movement? Give me an example. Roots of the skull. Epiphyseal disc of the long bone. These are joints. But why God creates joints although they don't allow growth? Can you swear? Can you say Wallahi al-Azim they allow growth? Yes, because they disappear by the age of puberty. Age of puberty. You know what's your age of puberty? كم؟ انتم 13 14 عشان خاطر عمو. هو it is the age of eruption of the wisdom tooth. 18 in girl, 21 in boy. Any person who is still growing. على فكرة يا دكتورة، انت يا دكتورة، انا ما بحبش حد يخرج وانا بشرب ولازم تستاذني. You have to take excuse. Do you understand? Go. Any person who is still growing is a child. اللي ما عداش 18 سنة لسه child. And he can go to a pediatrician, دكتور أطفال. Diaphragm. In diaphragm, I would like to say, diaphragm does not cross a joint. How can it act? لا بس دي انت توديني البحر وترجعيني عطشان. تقول لك مصر الأطفال سند الأطفال. مرة طالب في الشغل يقول له روح القطر التاني كده، وايد القطر لازم تبين. قال لي ربنا عايز كده. إجابة صحيحة. God wants it like that. أقدر أعجبه؟ تقدر تكون مرة. بس أكلته وكالي، قال لي ليه؟ قلت له ربنا عايز كده. تتصور؟ على فكرة do you have another example of a muscle which doesn't cross the joint in your head? Bassinet? From behind forward. It doesn't cross TMG. Levator in eye. It doesn't cross the joint. Mylohyoid muscles. They do not cross the joint. Right? Can a muscle act if it is not crossing the joint? Yes, all these muscles should be convex. Diaphragm is convex upward. When it contracts, it is centered, increasing the vertical diameter of the thorax, acting as an inspiratory muscle. Right? The veterinary muscle, convex downward. When it contracts, convex upward, it is centered. Convex downward, it ascends. Elevating the anal canal. Do you need to elevate your anal canal? Yes, because it facilitates defecation. If the stool is going down, it will be much easier if the stool is going down and the anal canal is going up. This facilitates defecation, oxygenation. Convex lateral. When it contracts, look, while you are masticating, you are convex like that. When it contracts, it becomes straight, right? Squeezing the cheek against the gum, closing the vestibule of the mouth, preventing accumulation of food and saliva in the vestibule. Mylohyoid muscle, convex down. When they contract, they elevate the floor of the mouth. Why? I want you, all of you, to swallow and look what happened to your tongue. It goes up to touch the palate. In the first stage. So the tongue has to go up to push the most food backward. Tongues go up, touching the palate by elevating the floor by mylohyoid muscle. Organs. على فكرة. All organs of the abdomen come in the exam. All organs, without exception. But there are organs which concern us, especially liver, spleen, gallbladder. Kidney. في عندنا سياحه وفنادق اهو. قولوا لي stomach is much smaller in size and weight than the transverse colon. هو طالع بالصوت؟ الصوت طالع؟ تمام؟ Stomach is much smaller than the transverse colon. If you get a scale and put the stomach on one side and the transverse colon on the other side, transverse colon will be heavier. In spite of this fact, stomach is supplied by 5 to 6 arteries. Transverse colon supplied by 2. Yes? Eh? طب اعمل لي تمرينات stomach. Stomach is much more muscular. عشان الجلاد. طب الجلاد كله جلاد يا حته واحده. ايوه. ايه؟ It needs a higher level of regeneration. Being exposed to HCl. HCl will destroy the mucosa every now and then. So, if the mucosa is destroyed, it will lead to peptic ulcer. But to all of us get peptic ulcer. You know why? Because once the cell of the mucosa dies, because of the rich blood supply, there's a lot of food, lot of nutrients coming to the stomach. This will lead to rapid regeneration. Before development of ulcer, the dead cell will be replaced. This means stomach being exposed to wear and tear by the HCl needs a higher degree of vascularity. And this gives us the impression that healing is linked to vascularity. Any tissue which is highly vascular has higher and perfect degree of healing. Do you understand? Do you think bone has a great power of regeneration? Yes. You remember section of the bone? You remember the Habergian canals? Thousands of canals, tiny canaliculi, containing tiny arterioles. You know when the bone breaks, it bleeds. The العظم يكسر بينزل. This means that the blood is very, very rich in blood supply. Do you know after healing of fractured bone, if you take section in the microscope and look and ask you, can you tell me where was the fracture? You can't tell. This means that the healing of bone went back 100% back to normal. But the skin after cutting leaves a scar. This means the skin doesn't go back 100% to normal. This means that the vascularity of the bone is even higher than that of skin. If I want to remove the gallbladder, there are two choices. Either to make middle line incision and then distract, and your assistant يفتح الكاب to reach the gallbladder. عجبني؟ يا اما subcostal incision, but middle line incision through the linea alba being fibrous, it is poorly vascular, and the incision will be less bleeding. But cochlear incision, I mean subcostal incision, عايز ايه؟ يلا عطلنا. اسمك ايه؟ لا 10 درجات زياده بس ما تجيش يلا هو قولها يعني استنى ساعه. Middle line incision is less bleeding. بقول لك I don't want the patient to bleed. انما الكوخه subcostal incision cutting the muscles shows a lot of bleeding. مش كده؟ But if you make middle line incision, healing will occur 10 to 15 days. Imagine the patient had constipation in the hospital. Gallo sad. And he went to the WC. Wound will rupture. Or if he has coughing, wound will rupture. But subcostal incision, because of the high vascularity, you can remove the stitches after 3 days. This means if you have a patient with peptic ulcer, I would think that there is something affected the blood supply of the mucosa of the stomach. To the extent that after damaging the cells by HCl, it couldn't heal fast enough, rapid enough to prevent the development of the ulcer. And I will think I would like to give him drugs which improves the perfusion of the stomach by blood. Imagine anatomy tells you what is the cause of the ulcer and how to manage the case of ulcer. First part of the treatment. 2 engines receive 4 arterial supplies. Right gastroepiploid in the first engine. Suprarenal, superior pancreatic renal in the second engine.